What is plantar fasciitis? It is simply an inflammation of the plantar fascia. And that's what the itis component of the term stands for, is inflammation. And the plantar fascia is an anatomical structure on the bottom of the foot. It is a dense sheath of connective tissue that runs from the base of the heel to the ball of the foot. And it's there to help provide structure for the arch of the foot, and it plays a large role in stabilizing the foot and ankle complex in weight-bearing stances, and primarily when we push off of the ball of our foot. Now, what they've started to find in the literature is that plantar fasciitis is not always or necessarily attributed to localized inflammation in that area. And they're starting to see that it has more of a degeneration of the tissue in that area. So you may hear it also referred to as plantar fasciopathy. How we go about addressing and treating it, though, is very similar moving forward. So we know that plantar fasciitis is a very common orthopedic injury, but we need to better understand who is actually getting it and who is suffering from this or may be at risk of getting it. And the easiest way to think about this in most injuries is we are asking that tissue, the plantar fascia, to do something that it is not adequately prepared to do. Now, that's a very broad way of saying it, but you can think of this as two different categories of individuals. And we often think of a very active category of individuals and a relatively more sedentary or inactive category of individuals. When we talk about our active individuals, think about your people who are runners or your athletes who are constantly doing physical activity. Motions such as running and jumping and any weight-bearing activity where we're pushing off the ball of the foot is going to put more stress and demand on the plantar fascia. Now, that is perfectly fine, but they start to get into trouble when they don't take into account these three variables with physical activity, and that is intensity, frequency, and volume of activity, meaning these are often people who are exercising at very high intensity, very frequently, or many days of the week, and they're doing so within each exercise session for either a long period of time or performing a lot of repetitions. Now, it is not inappropriate to do intense activity, or to work out every day, or to do long periods or high volume of activity, but it needs to be a little bit of a sliding scale. And if we are working out at a higher intensity, we need to decrease the frequency or the volume a little bit. Or if we want to be active on an everyday basis, we need to make sure that we're having some days that are lower intensity or lower impact. And this is where a physical therapist, a personal trainer, or somebody in the health, wellness, and fitness space can help coach you on what's an appropriate way to remain physically active without putting too much stress on that tissue. Now, the other category of people, we talked about them being maybe more inactive or sedentary, and this may be by personal choice or it may be by circumstance. So think about people who maybe they're coming off of another injury or illness, or they just haven't had the opportunity to be as active as they want to be. These are individuals that tissue, the plantar fascia and the surrounding muscles, it may not be as strong or it may not have the endurance to be able to accommodate the task of what they're trying to do. And in the physical fitness world, you'll also hear this referred to as capacity, how much an individual or how much a tissue on that individual can do. This is where we look at localized strength and endurance with some of our physical fitness tests. So these are individuals who just common daily activities or occupational demands when they're up on their feet, moving around, may pose more stress than what they need to because that tissue isn't quite ready to accommodate it. The other category of people that falls into this are maybe people are active, or maybe they're not as active, but they're attempting to do something different. So maybe they've always been a walker and they try to run, or they've always been a swimmer and now they take on some other type of activity such as pickleball or tennis. Maybe they've transitioned to doing indoor sports to outdoor sports. We've had a change in surface or a change in footwear, meaning tennis shoes to cleats or flip-flops or barefoot. All of these new activities can be kind of a shock to the system. Maybe the tissue has been active for a period of time, but it just hasn't been exposed to that particular demand, and that may be something that agitates the tissue. And that's an example of a more acute or sudden irritation of the tissue, as opposed to something that's more chronic, where it's been building over time. So now if we have a better understanding of what plantar fasciitis is, what population of people are more likely to get it or are already dealing with it, we need to ask the question, what do we do about this? And I think the first thing that we need to be mindful of is the severity of the issue that we're dealing with. And we can not only get an inflammation or a degeneration of the plantar fascia tissue, but we can also actually develop a tear or a rupture of that tissue. Now, this will present drastically differently. Typically, it's going to be brought on, a tear that we're speaking of is going to be brought on with an acute trauma. So think about an individual that they go to sprint. Maybe they're chasing after their dog, or maybe they're playing a sport. Their foot hits the ground, they feel and they hear a pop on the bottom of the foot becomes very bruised, it becomes very swollen, they're unable to bear weight on the foot. That's more indicative of a serious injury to the tissue. And in those circumstances where we have very high pain levels, we have a high loss of function, meaning we have an inability to walk or bear weight comfortably on the leg, and we're dealing with swelling and bruising. Those are all criteria that would make me want to seek out formal medical advice and figure out what is the most appropriate way to triage this condition. If we're dealing simply with a more mild version of plantar fasciitis, there are some safe things that you can do at home to start the process prior to seeking out help, or to help make things a little bit more efficient along the way. These are also exercises that if you go to see a physical therapist, they're probably going to introduce you to them and give you a little bit more refined coaching and cueing for them based off what your individual circumstances, ability, and needs are. Now, later in this video, we're going to go through some different exercises and self-care strategies that we can do to reduce the pain of plantar fasciitis and address all of the different factors that may be contributing to why we had it in the first place and how we can get rid of it when we're currently dealing with it. Some other things and tactics that work for people are things such as modifying their activity. So if we have found that we want to be physically active, but there are certain types of activity that bother it, those tend to be ones that are higher impact in nature. So potentially substituting running for walking, or even substituting walking and running for something such as cycling or swimming or other low impact activities is an easy way to maintain physical activity levels, which is often recommended with this injury, without exacerbating the injury that you're dealing with. Other things that we can do is look at the type of footwear that we're utilizing. And you'll often hear footwear or different inserts or orthotics being referenced. We mentioned the plantar fascia as being a dense band of connective tissue that helps provide stability and helps create the arch of the foot. Our footwear also does this as well. And it is a little bit more of a nuanced conversation of what is the best type of shoe for me, or what should or shouldn't I wear based on your own comfort and your own goals. But we do need to be mindful of how the type of footwear we're wearing is going to influence the function and the demand on that tissue. You can look at shoes on a broad end of a spectrum. You can have shoes that are considered more of a stability or a motion control shoe. Think about this as a shoe as when you grab it and you try to bend and twist it, and there's not much movement to it. These are really great at providing additional stability for the foot and the ankle and the arch of the foot. If we're providing more stability through the utilization of the shoe, it's going to take some of the loading and the stress off the plantar fascia and could potentially be beneficial when you are dealing with this injury and are having symptoms. On the other end of the spectrum would be more of our minimalist shoes. So this can be as far as being completely barefoot or wearing shoes and footwear that resemble being barefoot. Now, the benefit to this is you have no restriction with that footwear. The foot and the ankle can move as it is designed to do, but that's going to put a lot more demand from a stability, from a balance, and from a strength standpoint on the tissue of the foot and the ankle, which, if you're highly symptomatic or actively dealing with this, you may not be at a point where that's tolerable, and you may need to look for some more supportive footwear. Other general things that people have had success with is something as simple as just putting a soft heel cup into the shoe. And really what this does is, if you're very point tender on the heel where the plantar fascia meets the bone, that heel cup just acts as a shock absorber, so you don't have that sensitive part of your foot pressing against the firmness of the shoe or the ground that you're walking on. You may also see people get custom-made orthotics or just over-the-counter orthotics, and these are thought of very similar to that motion control or highly stable shoe, but there's something that you can take in and put out into different footwear so you have a little bit more variety with it. And if you get them custom made, you can have it be catered more towards your specific demands as opposed to a generic one that you get over the counter. Obviously, how readily accessible these are and the price points of them will drastically vary as well. So now let's get into some stuff that we can actually do to influence this, and this is where self-care and exercise comes into play. So we're gonna grab a few different pieces of equipment and we're gonna go through the following categories of activities that we can do. One being for symptom management, one being more mobility based, one being more strength based. And when we think of strength, we're gonna break that down into a few different categories. We're gonna look at isolated and localized strength of the foot, ankle, and calf complex that helps stabilize and support the arch of the foot. We're gonna look at more general strengthening for the lower body. And it's great to have a very solid foot and ankle, but we need to teach that part of the body how to integrate and work with the rest of our legs so that translates to more functional activities. Those types of activities also do really well when we are highly symptomatic and we may not be able to tolerate something more focused on the foot. They may serve as ways to substitute in, staying active, and keeping on with your fitness goals. And then the final category is going to be more balance and stability in nature. So two common things that you may see with plantar fascia rehab or recommendations is to roll the bottom of the foot like I'm doing with this lacrosse ball, or you may have heard using an ice bottle as well, or to foam roll the back of the calves. Now, what they found in the literature is that you're not necessarily doing what they thought we were doing maybe 10 or 15 years ago. We're not breaking up adhesions, we're not lengthening tissue, but what we are potentially doing is making things more comfortable by providing a different tactile or sensory input. So, rolling the bottom of the foot or rolling the back of the calf with a foam roller can be effective for pain management, but just make sure you appreciate what you're doing. We're not breaking up adhesions. We're not trying to do anything from a circulatory standpoint or from lengthening tissue. We're simply trying to promote that therapeutic touch or that healing touch and making things more comfortable, which should allow us to do things following that, such as stretching, strengthening, or just general activities of daily living with less discomfort. Now, one category of exercises that we want to make sure we hit is stretching and mobility. And there's a few different ways that we can go about doing this. The first one is going to be more of an isolated stretch for the actual plantar fascia. This is very effective to do first thing in the morning, right when you get out of bed, or after you've been sedentary or seated for a long period of time. And to do this, you can be in a seated position. We can have one hand on our heel to stabilize that because we know the plantar fascia attaches right here. And then the other hand is going to come up over top of the big toe. And I like to take this part of my finger and put it right on the ball of the foot. And then that way, with this hand, I'm stabilizing the heel and pulling down a little bit. And then I'm bending the toes back within a tolerable level of stretch. And you can hold this stretch for about 20 to 30 seconds. And we should feel this throughout the arch of the foot. Now, if 20 to 30 seconds is a long period of time or it becomes a little bit too intense, you can do shorter holds of about 5 to 10 seconds and just gradually take the pressure on and off. What this will help do is help lengthen and stretch the tissue before we get up on our feet and start moving around, where it's going to have to do that, but also with our body weight behind it. So in addition to stretching the actual arch of the foot and the plantar fascia, having flexible calves can also reduce some of the tension and some of the sensation that you feel in the bottom of the foot. So one of my favorite stretches for this is just a traditional calf stretch where the leg that's behind me is the one that's getting the stretch. And to make it a little bit more targeted to the foot as well, instead of having the foot flat on the ground, we can use this slant board like we have in our gym at our facility, or you could simply just take a towel and roll it up so it's a little bit more thick and put that under the ball of the foot and the big toe to cock the toe and the foot up a little bit. With this, we can try to keep that back leg as straight as possible, and we should feel a really nice stretch going from just behind the knee, down the back of the calf, and you may feel it go into the foot as well. With this, hold for about 20 to 30 seconds, and as I'm doing, you should be able to carry on a conversation. So if you find yourself holding your breath, or you're wincing, or you're grimacing as you're doing it, you're probably pushing a little bit too hard. With this, do it on both the affected and the unaffected leg, and then that way you have a general idea of what it feels like on normal circumstances with the healthy leg, and you can try to mimic that and match that on the leg that you're rehabbing. Another way to stretch out the back of the calves in a little bit more of a total body stretch would be a downward dog variation. So with this, we're not only going to target the calves, but you may feel this in the back of the hamstrings, the back of the thigh, or in the lower back. And I like this because you can integrate it as part of a larger, more holistic strength and flexibility routine as you're still actively addressing the plantar fascia. So two different ways that I'll show. One with both legs at the same time, and another where we're pedaling one foot back and forth. As we have both legs, we're going to have the toes into the ground, we're going to have hands under our shoulders, we're going to elevate the knees, and then from this position, we're going to try to straighten the knees, and as we do that, the heels will progress towards the ground, and then gently and gradually come back out of that position. As we do this, to get more of a stretch, we can bring our head further between our arms and try to get our hips higher into the air, or we can walk our hands back as we do it. Now, the other variation is to bias one leg at a time, and you'll get a little bit more intense of a stretch with this as we pedal side to side, gradually taking pressure off of one leg and onto the other. Now, we've talked about rolling, we've talked about stretching, but the key component to plantar fasciitis rehab is strengthening. And that's how we're gonna get more successful long-term outcomes. And when we talk about strengthening, heel raise or calf raise activities are really at the forefront of most programs. Now, there's a variety of different ways that we can do this. And for those who are highly symptomatic or they don't have the strength on one leg, we start them in a two-footed position. They can have their hands on something to help with balance and support, but we don't want to be leaning into it as we go. And we want to encourage them to get the heels as high off the ground as they can. And we're going to hold this as an isometric for 20 to 30 seconds. And ideally, we can hold all the way up to a minute without having significant discomfort or having the heels lower down. If somebody is able to do that, then we can progress to a single leg isometric, where we are asking them to do the same thing, just on one foot. After we can tolerate isometrics, we go to eccentrics, which is the slow lowering component of the activity. And we typically do these in about sets of 8 to 12 reps. So for this, we would go up on both feet, shift over to the affected leg, and slowly lower down. Up on 2, shift to the affected leg, slowly lower down. When that becomes tolerated well and easy, then we can get into more of what we call our isotonics, which is the full up and down motion. And we will start with both feet on the ground. We want to be able to perform higher repetitions, so ideally sets of upwards of 25 reps. When that's able to be performed, then we can transition to more of a single leg variation. Now, you'll notice everything that we've done so far has been with the foot on the flat ground. As we get into later stages of strengthening, we can progress into elevating the feet onto a plate or off the edge of a step and doing the full range of motion where we're now not only getting the feet comparable to flat to the ground, but actually letting the heels drop below that. This is going to put more of a stretch on the calf and the arch of the foot. So if you try to do this too early on, it may end up being a little bit symptomatic. But this is something that we can progress to in the future in both a double and a single leg option. In addition to strengthening the foot and the ankle, we want to develop overall lower extremity strength to help support the foot and the ankle, but these can also serve as ways to stay active when you're in the more acute phase and things are a little bit more irritable. And 3 simple body weight exercises that we can do to promote strength of the lower body are a body weight squat, a split squat, and a lateral squat. For the body weight squat, simply have feet roughly shoulder width apart. Feet will be mostly oriented forward. If they're a little bit out, that's okay. And then you're gonna squat down to a comfortable depth. That's gonna be a little bit different for everybody. Some will be able to naturally go a little bit lower than others. Try to keep weight evenly distributed. Try to keep your chest up so you can see the reading on the front of my shirt, and perform sets of anywhere of 8 to 12. When we look at a split squat, we're gonna bring one foot in front of the other. With this, we are now having a little bit more balance and stability demands with the legs staggered. And you'll also notice my front foot is flat, but my back foot, the heel, is off the ground. So this is important for plantar fascia rehab because that back foot is gonna be loading the plantar fascia a little bit. You should have about 60% of your weight on the front leg, 40% on the back. Try to keep an upright posture as we tap the back knee to the ground. Think about dipping that knee into water. Try not to make too big of a splash. 8 to 12 reps on one side, then switch and do the same thing on the other. And then finally, we can get some side to side movement involved with our strengthening. And we can do more of a lateral squat, where we keep one leg straight, we lunge or squat onto the other leg, keeping both feet flat, keeping shoulders, hips, and feet oriented forward. With these, 8 to 12 reps on one side, same thing to the other. For all 3 of these exercises, if body weight becomes easy, simply add an extra weight, such as a medicine ball, a dumbbell, or a kettlebell to make it a little bit more challenging. The last category of exercises that we're going to talk about can still qualify as strength training, but they're going to have a little bit more of a balance and a stability component to it. The first one is going to be called a nose to wall exercise. And with this, we're actually going to use this column of the squat rack, and I'm going to be on the affected foot with one leg off the ground, and I'm going to try to be as vertical as possible. This foot is going to be flat, and I'm going to drift forward like I'm trying to touch my nose to the bar and then coming back. With this, we're not bending the knee, we're not bending at the waist, so all of the motion is coming from the ankle. Now, as you're doing this, you're gonna feel the arch of the foot and the muscles in that area working all around where the plantar fascia and the arch is. With this, it should be a slow and controlled motion. We want to try to keep that heel flat and see if you can string together 10 in a row without losing your balance. In addition to that, if we want to get more of the body involved, we can get into a single leg RDL variation. And I'm doing this without any weight, but you could simply add a weight into your hand and hold it in front of you. And for this, it's the same starting position. One foot on the ground, one foot in the air. The foot on the ground, we're keeping it flat with the heel down. And then we're going to bend forward as if we're trying to touch the ground with our hand and then come back up. As you can see, most of the motion is coming from my waist and bending at the hip as opposed to squatting at the knee. So that's going to be an example of a little bit more dynamic balance and dynamic stability. Try to string together 10 in a row without losing your balance. If that becomes easy, you can add a mild to a moderate weight to it. It can be 5, 10, 15 pounds. If you're a stronger individual, you can get away with something heavier than that, but you will most likely feel the back of the leg, particularly the hamstrings, working when you do that. So in summary, plantar fasciitis, or sometimes referred to as plantar fasciopathy, is either an inflammation or a degeneration of the plantar fascia tissue, which is a band of connective tissue running from the heel to the ball of the foot that helps provide stability for the arch of the foot. It is often due to excessive activity or changes in activity or environment that puts an unusual amount of stress and strain on that area. If you're having significant symptoms, high levels of pain, you're unable to bear weight on the leg, or just losing a lot of function from a strength and mobility standpoint, seek out formal medical advice for how to treat this. If it is more mild, keep in mind that we can modify activity and we can trial some of the different strategies that we did today to at least get the ball rolling, as we're either setting up an appointment to go see a medical professional or seeing if we're able to triage this on our own. If you like this video, please remember to like, share, and subscribe, and stay tuned for the next video in our series on how to rehab common orthopedic injuries.